Good evening, ladies and gentlemen. Please grab a cocktail, grab some amazing dinner. It has been inspected by our health department. Anyway, welcome to the 150th Health Department anniversary, 1874 to 2024. And good evening, I am Sue Ponarelli. I am the 311 manager of the city of Evanston. Thank you. I'm sure you're clapping for all the work that we provide everyone in this room. So Ike asked me to be the MC this evening. I'm really very excited. However, I'm quite sure he asked me because of the years of service I've had at the city, plus my age, will equal almost the time the health department was started, 1874. Give or take a few years. But I want to thank Ike for inviting me and asking me to MC. Actually, this is like being the MC for the Oscars, right? One little slip up, one slap, and my career is ended. Tonight is an amazing, amazing evening. We have to recognize and honor the health department. We have amazing food, a great cocktail bar, and a vaccine bar. Could you imagine a nice vaccine bar? What's so exciting about the City of Evanston's health vaccine bar is it's not just your average COVID and flu shots. Oh no, we have shots from every era. So 150 years, we're not sure how they do, but what the heck. Just try it. We follow up with a cocktail. So a couple things. Does this not remind you of a bar mitzvah? Wedding? So there's a little table in the back. Leave your gifts, in case you were thinking that. So anyway, and then I am very excited to introduce our first guest speaker this evening. And he would like me to do his bio in another language. Unfortunately, I've left my other language skills at home, or maybe they're just in the car. But I would like to introduce the Honorable Daniel Biss, the Mayor of Evanston.
Well, thank you very much. It's never really easy to follow Sue. I'm going to do my best. Just bear with me. Hey, welcome to a truly joyous celebration. Thank you and congratulations to the Department of Health and Human Services. Congratulations to Director Ogbo. And could I ask all of the current and former staff of the department to please stand up and be recognized? You know, we are so appreciative of what you do, and I think this milestone is something to be incredibly proud of, but it's also something that maybe masks a really critical reality at the foundation of the department, which is that its existence is not inevitable and its persistence was not inevitable. When I talk to my fellow mayors across the county and across the state, most of them don't have health departments, and frankly, there was a time when people felt like maybe we don't really need a health department here in the city of Evanston. Maybe we might just be better off abolishing it. Wouldn't that save us a little bit of money here and there? And as those voices were beginning to gather steam, an event happened that jolted people into a realization of the importance of having a department like this. And I'm pleased to say that since the Spanish flu epidemic, there's not really been a word of concern about the question. Oh, right. But the truth of the matter is that a department like this, most of the time, when it does its job as well as y'all do your job, is invisible to most people, is unnoticed by many and underappreciated by even more. And when we had the more recent pandemic, I think a light bulb went off in a lot of people's minds. And people saw not only the communication and the services and the information that came out from the department, but they saw the results. They saw the lower infection rates. And yes, they saw the lower mortality rates. There are people alive in Evanston today because of the extraordinary work that you do. And I think that we are finally in a situation where more people in the community know and more people in the community understand. And there's many fewer calls to say, why don't we do away with this important work? But we have to keep on sharing that reality. And we have to keep on talking about the fact that health is not an inevitability or automatic or an act of nature or an act of chance. It's rather a consequence of planning and decisions and behaviors. By the way, before I leave this topic, I think it's important to also acknowledge somebody else whose really critical and important work had a lot to do with that success during the COVID pandemic. Would you all give a hand to my predecessor, Steve Haggerty, please? I'm not sure exactly what bit of good fortune led us to have a mayor with Steve's professional background and knowledge and skills at the moment that the pandemic struck. I don't think you campaigned in 2017 on a platform of a pandemic is coming, you're going to need me. But a pandemic was coming and we did need you, and we appreciate you very much for that, Steve. And so I just think that as we continue to navigate public service in this difficult time, as we continue to encounter a public environment that sometimes makes people in public service feel unappreciated, sometimes makes people in public service wonder if the stress and the challenge is worth the benefit, I just want to make sure that you all know, number one, you're deeply appreciated by me. Number two, you are deeply appreciated by a community that sees the benefit of this work and has felt it. But number three, and I know that this is the point that really connects with the motivation that brought you into the healthcare field in the first place, and I know that this is the motivation that gets you up in the morning and brings you to work every morning, and I know this is the motivation that puts that light in your eyes. The work that you do saves lives and transforms communities. And for that, we owe you the most extraordinary debt of gratitude. We are fortunate to have this department with 150 years of institutional memory that has brought you to this moment of remarkable excellence. And we need to commit to continue to invest in this department for the next 150 years, because that is the kind of service that a community like this deserves. Thank you for all that you do, and congratulations.
Thank you, Mayor Biss. So I do have some PSA announcements that Ike and his team did ask me throughout. Wash your hands. Make sure that you do it to the entire happy birthday theme. It is playing in the restroom. So the next guest was very concerned about my jokes this evening. I'm trying to see where Luke went. So Luke was definitely worried about my jokes, but I will save those for the after party, as he says. Anyway, but I would have the pleasure to introduce the city manager, Luke Stowe.
Good evening. It's very difficult to follow Sue and Mayor Biss. One of the hardest parts of my job is often following Mayor Biss. But I will do my best, and I'll be very brief. I did want to acknowledge several elected officials in the room. In no particular order, we have former Councilmember Braithwaite, current Councilmember Chrissy Harris from the 2nd Ward, current Councilmember from the 4th Ward, Jonathan Newsma. I believe I saw a former council member from the 8th Ward, Ann Rainey. Of course, former Mayor Haggerty. City Clerk Mendoza. And from the 9th Ward, Juan Hercaris. Did I forget anyone? Oh, Josina, yes. Welcome, Josina. How are you? I thought I was going to introduce you. Welcome. Oh, and former council member Fleming. She left already? Okay. Yes, thank you. First of all, thank you, Director Ogbo, for the opportunity to speak tonight at this wonderful celebration. I want to express my gratitude and appreciation to all the employees of our Health and Human Services Department for your outstanding dedication to the city and our residents. HHS offers an impressive array of services, each one playing a crucial role in our daily lives, from food safety to beach water testing, from workforce development to general and emergency assistance, from public health preparedness to, yes, rat control. The city of Evanston was incorporated in 1863, and the health department was created just 11 years later, even 1 year before the Evanston Fire Department. Sorry, Chief Pollock. This demonstrates the importance of public health even in Evanston's earliest days. I want to commend the department for its outstanding work in identifying, securing, and retaining numerous grants. This grant funding has allowed the city to deliver important services to our residents without increasing our budget. We appreciate Ike and his team for providing outstanding services while being frugal with taxpayer dollars. In addition, I remain very proud of the city's COVID-19 efforts. I believe we provided best-in-class services and a response for our residents, especially our vulnerable groups. To be sure, it was a whole city effort, including nonprofit and private sector partners, but clearly having a dedicated health department was key in us delivering critical services during a once-in-a-generation event. Finally, I want to thank HHS for their ongoing efforts highlighted in our city's E-Plan, which addresses health inequities in our community. We have unacceptable metrics where you can literally cross the street into an adjacent census tract and see a 13-year difference in life expectancy. Our health department, other city departments, and our other external partners will continue to tackle these challenges head on. Here's to another 150 years. Thank you.
Ike, does this count as steps? I ended my day with 10 steps. All right. Is that wrong? Anyway, our next guest speaker today is Cook County Commissioner Josina Morita, and I have the pleasure of introducing her as well. Welcome.
Good evening, everybody. So I'm here as your Cook County Commissioner. I'm also here as the daughter of a public health worker. I think we in this room know how essential public health is. And like Mayor Biss said, that has not always been true. We're very unique here in the 13th District where we actually have 5 different public health departments. We have the state, we have the city of Chicago, we have Cook County, we have the city of Evanston, and the village of Skokie. And so I'm here with kind of 2 hats on. One, to say thank you for the service that you do to the residents of the 13th District, and also thank you for your partnership with Cook County Public Health. You know, we run the health and hospital system, and sometimes public health is something that is seen as smaller or lesser than, but I think for those of us who have worked in public health, we know that public health is the core of health, right? That it's not just the actual medical services that you get once you're sick in a hospital, but the role of public health in education, right? We saw that during COVID-19 in particular. Empowerment, it's not just whether people are sick or not, it's whether they are empowered with information to make the right choices and to get the right care. It is about equity, right? To Luke's point about making sure that everyone has access to the same information, the same resources, and that we don't have those disparities that he talked about. And it is literally essential. You know, information, again, we saw this during COVID-19, could have been a matter of life and death. And so thank you to Evanston Public Health. Thank you to those here who have literally saved lives here in the city of Evanston. We appreciate you, we see you, we thank you, and congratulations on 150 years.
Thank you. So our next guest speaker, I have his resume. We should be here for about the next 15 minutes. So I actually don't have his entire resume bio, but our 21st Mayor, Honorable Mayor Steve Haggerty, will be joining us in just a moment. He is always connected with the city of Evanston, whether it's taking other employees that used to work here or visiting with us as well. So I'd like to invite Mayor Haggerty to come up and say a few words. Thank you.
For the record, I do not recruit City of Evanston employees to come to Haggerty Consulting. Some have come to Haggerty Consulting, but there's no effort to do that. It's true. It's true. It's true. I love the city of Evanston. We are fortunate to have so many of you here and others that aren't here tonight working for this great city. The question that we all have to ask is, when something bad happens, when something scary happens, will you rise to the moment? Will you rise to the moment? We had that moment happen here, and it happened all across this country. And I'm so glad that folks in this room and outside this room and our entire community rose to the moment. I'd like to recognize some of those folks that are here. If you worked, I'm going to do it in a couple different ways. If you worked for the Evanston Health Department during COVID-19, would you please stand up? I want you to stay standing. I want you to stay standing because amazing people. If you volunteered during the pandemic and helped with COVID-19, you keep standing up, you guys, for a second. If you volunteered, would you stand up? If you're in the Evanston Fire Department, thank you, volunteers, stand up. If you're in the Evanston Police Department, stand up. If you're with a nonprofit that helped us, please stand up. Betty Boggs, Connections for the Homeless, others. If you're on the mayor's COVID-19 task force, Dr. Neighbors, others, please stand up. There's something in the emergency management world. You can have a seat now. There's something in the emergency management world called whole of community. Okay, whole of community response and recovery. What that means is, it means if you think the government's going to save you, or if you think your plan is the government's going to save you, you don't have a plan. If you think your plan's your church is going to save you, you don't have a plan. If you think your business is going to save you, you don't have a plan. The reality is, all of us have to come together when something really bad happens. We're all observing something really bad that happened over the last couple of weeks in Florida and in North Carolina. It's terrible. I've got teams in all those locations. In Western North Carolina, it's really bad. We had somebody that people in this room would know who was caught at a retreat in Western North Carolina, who was calling me frantic and concerned, right, about their child. It's no different than when COVID-19 happened. I have all sorts of emails, phone calls that I received of people who were really scared. It was a scary moment, and you can forget that pretty easily when we have, a vaccine now for it and everything else. But if you lived at that moment, as many of us did in this room, you knew the uncertainty, and we didn't know what we were dealing with. And we are so blessed in this city that we have the second oldest health department in the state of Illinois. We are blessed that we never got rid of it during those hearings over the years, including when I was first mayor of this city, where we had a budget deficit and people came and said, well, we really should eliminate this health department. Like, what does the health department do? Thank God we didn't eliminate the health department. Can I tell you that as mayor, I received calls up and down the shore from other communities who didn't have a health department, as Commissioner Marita just said, who said, Mayor, can you help us? The vaccines are out and everything. Maybe we could, team up with Evanston and you could get some of our residents vaccinated. And I went to the Cook County president. I said, listen, we've got the apparatus here. If you want to provide us with more vaccines and we take care of Evanston first, we will then go and take care of other communities up here. And there were limited vaccines, as we all know. But all of that happened because this community made an investment a long time ago and has continued to make that investment in public health. And I'm just really, really proud to have had the opportunity to work so closely with them. And just one or two quick stories. So we were the first city in the state of Illinois to declare a local state of emergency. And that was with we didn't have one case of it. I saw what was going on. And as mayor, had the power to declare that and met with Ike and said, I think we should do that. Now, before that happened, I received a call from a mom here in town who I'm acquainted with, I don't know particularly well. And she said, Mayor, my 12-year-old is really, really worried about what he's seeing on the news. I thought it might be good if he could come to the mayor's office and meet with you, and you could tell him what our plan is. I said, oh, plan. And I said, I think that's a great idea. Have him come to the mayor's office. So he came to the mayor's office, and he came with a friend. And I quickly said, Ike Agbo, I need you and Elizabeth. Is Elizabeth in the room somewhere here? Elizabeth came to that meeting. It's here for Elizabeth right there. And we met with these two young kids. And you could sense the fear, right, and the uncertainty. And here we are, the adults in the room, and we want to put people at ease. We took that opportunity right after that. We took a photo in the mayor's office, and you can find it out there. And that was the first communication that we issued out of the mayor's office. And that was in February. So that's before the state local emergency, before the national emergency, and all of that. One of the things that made us successful is that networks were built before the pandemic happened. I can't stress enough, having spent my entire career helping communities after disasters, those communities that have a strong social fabric will respond and recover faster than those communities that don't. So you say, well, what does it mean to have a strong social fabric? Well, it means that you have built networks, that you have done preparedness work, that you've been infrastructure. All of this work has been done before something bad happens. The reality is a disaster is coming to a town near you. Nobody thought something was going to happen in western North Carolina. It's not in the floodplain, and it was a massive flood that they had. And it was a weird flood, right? Because it wasn't a river that rose up. And so we need to take the opportunity. I think we do a really good job in this city, but we need to take the opportunity to build those networks before something else happens in this community. But I know if something else happens in this community will come together as it did during COVID-19 and, practice whole of community and come out of it stronger as we have. So it was a privilege to be the leader of this city during that time. I never imagined there would be a disaster when I was the mayor. But it was a privilege to work with all of you in this room and others. And so thank you, Ike, for inviting me, giving me a few minutes. I know I think I talked longer than the actual mayor, so I apologize for that. And let's get on and have a good evening. So thank you.
Thank you. And it was a privilege to work with you as well, Mayor Haggerty. It was. Thank you. So in just a few minutes, I'm going to introduce our actual host, Ike Agbo. But I have to share some things before we do that. Who here has received an email from Ike? Exactly. So I went back, Ike and myself and the 311 team and the health department worked extremely close during COVID. So he had that calming effect. And I truly went back through my thousands of Ike emails. And I'd like to share a few. So those that don't know, Ike opens his emails with around the same 4 openers. Okay? And I'd like to share some actual emails from Ike. Hello. I'm not going to do the accent. I won't do it justice. But you can read into it with me. I hope you're having a pleasant day. Do you know the staff members' names that you may have had contact with? Okay, are we doing contact tracing here? Are you the first COVID person? What? I hope you have a pleasant day. Or good day. Good day, Sue. Hope your team is doing well. The state of Illinois is going into a lockdown. What? Is that true? Hello, Sue. I hope you are good. We have emailed 100,000 Evanston residents. We only have 75,000, but to give 311 a call about vaccines. I'm not sure we even had a phone system yet. I hope this email finds you well. You may have heard the news about disease XYZ, but not to worry, it hasn't gotten to Evanston yet. Have a pleasant day. Or continue to have a pleasant day. Like, even if I was having a pleasant day, you just ruined it. You ruined it. But I do enjoy Ike's emails. I look forward to them on a daily basis. Anytime you're by my office, I have a folder, Ike, so we can review. So with that, Ike, I hope you have a pleasant day. And I would like to introduce our host and director of the Evanston Health and Human Services, Ike Ugbo.
I'm dumbfounded. Good day, everyone. I have a funny story. Alderman Rainey, you probably remember this. I used to manage property maintenance a number of years ago, and there was I used to manage property maintenance years ago, and Alderman Rainey, she sent me an email regarding this property. And the property owner wasn't doing what he was supposed to do. And there was some frustration there. And I remember sending Alderman Rainey an email to inform her of the strategies that we had taken to correct whatever those violations were. And of course, I included, thank you and continue to have a pleasant day. Her response was, well, this email that you sent me has actually calmed me down. This is how city officials should be sending emails. So I remember that. Actually, I think I saved that email. So anyway, thank you for being here. I truly appreciate you being in the midst and us celebrating 150 years of public service. Throughout those 150 years, I was present. I was just like, I wasn't present. But going through the history of the health department, I felt that I was inserted in there. Because some of the issues that we faced then, a number of them eradicated, or some that we continue to face today. But I thank those who came before me and those who will come after me for all the public health services that we've rendered in 150 years and that we'll be rendering in the near future. I have a few thank yous. I want to thank Hilton for providing such an amazing space here for us to celebrate this anniversary. I want to thank all the representatives from various organizations that we've worked with over 150 years who have supported the health department. Thank you and welcome. I want to thank our community members and residents whom we serve on a daily basis, who are here and elsewhere in the community. I want to thank City Manager Stowe, our deputy city managers, head of departments, managers, supervisors, staff, who work collaboratively with the Health and Human Services Department to achieve desired goals. I also want to thank all the elected officials, past and present, who have always supported the health department. I also want to thank the sponsors of the event, who decided that we ought to celebrate this event in style. I would like to thank Mayor Haggerty and Consultant. I would like to thank Endeavor Health and all the anonymous donors who contributed to ensure that we have this event today. I want to thank the Health and Human Services staff. They absolutely know how I feel about them. They are diligent, they are professionals, they are talented, they are passionate, they are tremendous. It's a very small team. When we are fully hired, there are less than 40 of us, but they do miraculous work. So to me, to you, I want to thank you for all the work that you do. Also, I want to give a special thank you to the organizers of this event. A lot went into this event. I want to thank our communications team, Jesse Mayo, Cynthia Vargas, Anderson Castillo, Gary. Thank you for all you've contributed to make this event a success. I also want to thank Lucas, I know I saw him somewhere, for providing the parking for us. Not only did he provide the parking for us, he also waived the fees, so thank you. I personally want to give a special thank you to my staff who planned this event, Nicola White, who's administrative lead, Greg Olsen, who is our public health manager, Indira Perkins, who is our human services manager, MJ Garbros, who's our disease intervention specialist, Ashley White, Demaya Fields, who is our human services specialist, including Kayla Smith. She's our community health specialist. She just started this week and we put her to work. And I'll be remiss not to acknowledge a special someone in our midst. I was going through the number of directors that we've had over the years that amasses about 20 or so. Most of them are no longer here with us, but we do have an individual who is in our midst and I want to recognize. She was the director for the health department for 15 years, I believe, from 1985 to 2000. I would like to recognize C. Louise Brown, who is in our midst. Thank you for your remarkable service. It's appreciated. Public health is misunderstood or to some confusing. We have a video that I would like to share with you. It pretty much summarizes the importance of public health and he also highlights some of the challenges. I actually think that you will find value in this video. If you can roll the video, please.
Public health data like today by pandemic. Public health has always been invisible. Then you have a pandemic. And in this pandemic, that invisibility is gone. And it's not going. We need to tell the story of public health.
Public health has been protecting in Black Death.
There was a time when you went to work, it wasn't clear if you were going to come home from work.
2 centuries ago, a third of your kids were likely to die in childhood. Now, childhood is the biggest part of their life.
Many health problems really can only be improved through public policy. Clean water, breathable air, healthy food. These are protections that are made for all of us. Public health is a wonderful thing. In the last century, we gained 30 years of life expectancy due to public health.
To me, extending our lives is the most impressive thing that we have ever done as a species.
If everything's working well, nobody thinks about public health. We only fund when there's an emergency.
When invisibility crisis in public health and impacts our ability to be appropriately resourced. But I'm pretty worried that the funding can just because we look at
Public health has been undervalued, underfunded, and misunderstood, and that hurts our health.
In 2017, we began to see a decline in life expectancy. That is a bad sign for our society.
Public health was the foundation of your house. And let me tell you, ours is cracked.
So that paints a picture of public health, the importance of public health, the challenges that it faces, and how public health is seen. And I hope that any thoughts to hinder the growth of the health department not be something that is considered due to the value that public health provides our community. So, thank you.
Now you turn the lights down low when I look much better. A lot younger, too. All right. In just a moment, I'm going to introduce our next guest. But, you know, as I researched about emceeing this, I thought there's some interesting things about the health department. I am confident the health department has secret meetings about how to say things or inform people on what to say and not scare them to death, right? So I get emails. I can't pronounce. Communicable disease protocol. What exactly does that mean? They don't explain it, but here, call this number if you think it is. They use words like preventative, not risk, right? Or precautionary measures, as opposed to urgent danger, right? Oh, and I like this one. It's an outbreak. No, it's actually a pandemic, right? And don't worry, my favorite, most people fully recover. Most, right? So the other thing I didn't know about the health department was that they actually have marketing slogans. No, that is that a class in health department college? Marketing slogans. I'll give you a few right now or one now, and then I'll keep the others for later. We're the health department, saving the world, one flu shot at a time. Oh, well, that makes me want to run to Walgreens, right? All right, well, so far I haven't seen those marketing logos, but I'm sure we'll see them on the bus stops soon. So I thought that was fabulous. I have the honor to introduce the chief of the Evanston Health Advisory Council and a health and policy and administration professor at the University of Illinois, and that is Don Ziegler.
Thanks.
Okay. Dear friends and fellow citizens, welcome to the wonderful event in Evanston's rich history. For the past few years, I've had the honor of chairing EHAC, the Evanston Health Advisory Council. EHAC members are private citizens, part of this network that we're talking about civil society, our community, private citizens, health professionals, representatives of our schools, and diverse health agencies committed to working together to advise the city and its health department to address our public health challenges. EHAC has proudly worked with the health department as the health department has expanded its services beyond communicable diseases to address rising non-communicable diseases. For example, obesity and mental health, and adopting some of the state's first tobacco control measures. EHAC has supported our competent health department staff to develop our 5-year E-plans, the Evanston Health Plans that now wisely address social determinants of health, such as income and health disparities and challenges from climate disruption, while still continuing to protect us from persistent communicable diseases from food and waterborne illnesses, West Nile, and COVID-19. I am proud of what Evanston has done as a pioneer and consistent leader in public health over the past 150 years. With our amazing history, I predict that our next 150 will be even better. Thanks to our devoted staff, city leadership, and committed citizens for making Evans such a wonderful place to live, study, and work. Have a good evening.
Thank you. Thank you very much. And for our next speaker, I am honored to introduce Dr. Bruce Doblin, board certified in internal medicine and preventative medicine. He serves as a medical consultant for the Evanston Health and Human Services Department. Did that give you a good transition? Perfect. Thank you.
Thank you very much. This is quite a big crowd. It's a little bit intimidating. But fortunately for everybody, I think I'm the last speaker. I've provided assistance and medical input and opinions to the department for about the last 15 years on and off. But as a private internist in practice here in the community, I've wanted to speak a little bit about not the accomplishments of the Department of Health, but the things that I have learned as a physician working with the Department of Health. Most of you may know that the world of medicine and the world of public health can sometimes feel dramatically opposed to one another. They have different languages, they have different cultures, and they have different focuses. And one of the things I've seen is how much it is important to really understand how public health works and the value of public health in the community. So there are 6 things I thought I would mention very briefly. One is the value of the community. As a physician, you're trained to close the door and focus entirely on that one patient. There are 2 people in the room. It's you and the patient you're serving. The world of public health is dramatically different. It's important that we see all of the community and we appreciate all of the important work that's going on in the community, and that we bring services to everybody equitably, efficiently, and effectively. I wish that were true of our healthcare system in general. The other thing I've learned is that many times the people who need our services are not able to tell us that they're in need, and it's important for us as members of the public health community to go out and find them. If one of my patients is sick and they don't call and they're not making an appointment, I may never know that that's happening. Well, during COVID, what we did is we found that there were elderly homebound individuals who couldn't get out to get the vaccine. So we created an opportunity and a program to go into their homes to give them vaccines, reaching out into the community. I think that was the other thing that was really surprising. We offer healthcare in the traditional system, but you have to know how to access it. You have to have insurance for most of the things that you need. It's very different in the world of public health, and I think certainly more equitable. The third thing is really the Department of Public Health is an expert in convening, collaborating, and partnering with other organizations. And the wide variety of people here today is a great sign of that. They're working to bring people together as an honest broker. I think the department's really well respected and well known for that. I think it's the place where all of the interests of the city of Chicago, the city of Evanston come together. The fourth thing is that, of course, we're not always ready for the next public health challenge, but the department understands they must face it with courage, with science, and with humility. And that our world isn't stable, it isn't unchanging, and it's full of urgent matters. But the department continues to be flexible, continues to be creative, and continues to often be the first responder in a health crisis, seeking to find opportunities to provide service and safety for everyone. Without the work of the health department, I think it's pretty clear that many of the citizens would be poorer, they would be sicker, and they'd be less protected from the dangers that they face on a daily basis, even though they may not know the work of the department as it goes on. The department is good at looking ahead and providing service to the community without always getting the recognition that it needs, but that's not why most people in the department are coming together. And then the last thing is that the department is not afraid to take risks. And that's an unusual thing for a government organization, and to take controversial stands for the benefit of the public. The department over the last several years stood up to limit vaping and tobacco, stood up to limit the reach of cannabis in the community, stood up for providing reparations in an experiment with income assistance, and worked hard to establish a partnership with Erie that now provides care for so many citizens in the Evanston area. And I know that the future of this department will continue to take risks because that's a part of doing our job. So congratulations to everyone here, everyone who works with and for the department. I think this has been an interesting opportunity for me to get a real education of what health in the broadest sense means, and I'm excited about our next 150 year. Thank you.
Thank you so much. My next question would be, did you bring your prescription pad? But I won't ask that. I'm just saying I won't. I do have a really interesting fact about, I did a little research, as I mentioned, about the health department, what it would have looked like in 1874. All right, so a few facts. It would be a simple space with a few desks, a few chairs in the basement of 2100 Ridge. I realize it wasn't there, but that's what they were saying, that the staff members would be elected officials, part-time, and then health providers the other part of the time. You choose which side you'd like to go on. 2-hour parking for coaches and horses, or those PEOs are going to ticket you, and no advanced equipment, but lots of vaccines. That was actually from ChatGPT. I can't take full credit for looking back at 1874. I am going to bring Ike back up in just a moment, but I'd like to share a few more marketing tools that I really think that anyone in the health field should really write these down and use these. I would like to say, we are the only people who get excited about germs because we know how to defeat them. Or working at the health department means you never run out of hand sanitizer or reasons to use it. Or at the health department, our motto is, because Google isn't always your doctor. So anyway, thought they were fun. I think that, Ike, your next campaign will get Jesse and Cynthia. We've got all kinds of material for that. But I would like to bring Ike back up to close out the evening.
Yes, so we met with our communications team to create a video. You've probably seen it already, but if you haven't seen it, this will be your first opportunity to see it. If you've seen it before, you can see it again. And and I was urged to do the voiceover. Jesse Mayo insisted that I do the voiceover and said, it's high time that we put your voice to use. But it highlights 150 years of contributions of public health in our community. It does not include all. We added about 10 to 15 public health events that the health department contributed to. If you want to find more information about the history of the health department and other contributions, you can go to our website where it's highlighted there. So if you can roll the video.
"150 years of service, innovation, and public health leadership. Evanston's health department has been at the forefront of keeping our community safe since its inception in 1874. Well, it all began in 1874 when the Evanston Board of Health was formed. This was 3 years prior to the establishment of the Illinois State Board of Health. This laid the foundation for a long history of health initiatives, starting with the department's response to the typhoid fever epidemic in the early 1900s. Between 1901 and 1912, the department identified polluted water as the cause of the typhoid outbreak, which affected close to 400 residents at the time. The health department's swift action saved lives and set the stage for modern water safety protocols. Then, from 1918 to 1920, during the Spanish flu pandemic, Evanston's health department implemented early versions of the strategies that we use today, encouraging social distancing and prohibiting public gatherings to slow the spread of the virus. Let's fast forward to 1947, when the department pushed for the introduction of fluoride into the city's water supply to combat dental decay. This was an initiative that greatly improved oral health for Evanston residents. In 1964, Evanston's health department not only served Evanston, but it expanded, forming the Evanston North Shore Health Department, serving nearby communities and growing the department's impact. Let's shift to 1987. The department became a leader in the AIDS awareness at the time, offering counseling and testing at a time when the epidemic was still misunderstood. Close to 400 residents were tested that year and received crucial support. By 2001, Evanston faced a new challenge with the West Nile virus. The department acted swiftly by implementing measures to test mosquitoes, birds, while educating the public. These protocols remain part of the department's disease prevention efforts today. And by 2002, there were 30 cases of West Nile virus in humans. In 2006, the department championed the city's first smoking ban in public places, leading the charge for the rest of Illinois. A few years later, in 2009 and 2010, the department responded to the H1N1 swine flu by establishing protocols through public awareness, education, including vaccinations. Close to 30 vaccination clinics were set up, and 12,000 plus Evanston community members were vaccinated against the virus. In 2012, the opening of the Erie Health Center ensured that essential medical services were accessible to all, after budget cuts affected the department's own direct medical offerings at the time. Continuing its leadership in public health, in 2014, Evanston became the first city in Illinois to raise the tobacco purchase age to 21 to decrease tobacco usage among youth. That was ahead of the statewide law that was passed 5 years later. In 2014, Evanston Township was dissolved, resulting in the city assuming the duties and responsibilities of the township. Programs like general assistance and emergency assistance were absorbed in the health department. During the COVID-19 pandemic, the department took center stage once again, providing public education, situational awareness, weekly data reports, vaccines, contact tracing, and essential services to protect the most vulnerable community members. Recently, in 2023, the Evanston City Council approved a proposal to ban all flavored tobacco and menthol products with the support of the Health Department, making Evanston the first municipality in Illinois to enact a comprehensive ban. Now, in 2024, the department has begun using a new scientific method of qPCR technology to test and monitor the safety of beach water. This process expedites beach water results and help us to ensure that our community can enjoy safe and healthy summers. For 150 years, as you can see, the Evanston Health Department has stood strong, evolving, innovating, and always putting the health of our community first. Here's to the next 150 years of excellence in public health.
As you can see, the marvelous work of public health over the years, and as I indicated before, these are just a handful of public health events and contributions from the Health and Human Services Department. So we can see the significance of public health in our community. We have one more video that I want to show. This is an assembly of Health Department staff to talk about public health from their views. I have to keep in mind that the Health and Human Services Department does not only comprise of public health practitioners, we also have individuals who are human service specialists, social workers, and workforce professionals. So we will see what they think public health through their eyes and through their lenses. So if we can roll the video.
So public health is comprehensive and holistic well-being. It encompasses our physical health, our mental health, social well-being, economic well-being, and it looks at the health of the whole population and makes sure that everybody has the resources that they need to be healthy and thrive.
Public health and social services are natural allies, and I think we've worked well together.
Instead of treating an individual the way a doctor does, public health allows us to treat a whole entire community to help prevent them from having to go to a doctor in the first place.
Instilling prosperity from an equitable space for our residents and our community members, focused around improving and sustaining their health and wellness. That is not just encompassing physical and mental health. It encompasses financial health, economic health.
Health and Human Services is the foundation of the city. We make sure that your water is clean, your environment is clean, your air is clean.
I never heard of public health until I read a book on the 1918 Spanish influenza pandemic. Immediately I was hooked by this idea of public health, and I wanted to work in this field where the primary goal was to ensure the community's health is improved over time and where actions are taken to ensure the greater good of everyone.
During my time in the department, we were vital in partnering with bringing Erie Health Center here. That was beneficial for our general assistance clients because there wasn't a community health center in the community. So bringing Erie Health to Evanston was absolutely remarkable.
I had a case, it was a homicide, and our department was involved initially with the family, and the case took about 7 years through the court system. And finally, in year 7, the family got a guilty verdict, and just seeing them feel a sense of justice, like the work that we do as advocates had finally just come to the fullest impact possible as far as getting them what they wanted.
Getting to hold the first little bottle of the COVID vaccine.
In 2023, I assisted in developing HB 2619, which was a House bill with Robin Gable's office to ensure that our long-term care residents that are living in mental health homes have due process.
Our release of the 2022 E-Plan, which really articulated the connections between our history of redlining in Evanston and the disease burdens and patterns of health and well-being that we see today. And it really helped kind of share the message in Evanston that our health has been and continues to be affected by our legacy of racism.
It's helped provide resilience and perseverance to many of our community members who've been down, economically disadvantaged, economically in a drought, economically in a space where they're just surviving at this point.
By helping residents be more health conscious about how their day-to-day life impacts other people, whether it's keeping their yard and their property clean or letting us know about food violations, we just want to try and keep health on the conscious level of residents.
We do it all. From rats to resident rights, Health and Human Services does it all.
Thank you. It is great to hear from the staff who conduct activities of the Health and Human Services Department of their views regarding public health from various perspectives. So that's very good to see. I just have a very brief speech. You've heard it all. You've seen the remarkable activities and strategies and contributions of public health in Evanston. I don't know if you realize that today is Evanston's Public Health Day. Thank you for being here to honor that. Thank you to Mayor Biss, who declared October 24th of every year as Public Health Day in Evanston. And that is to reflect, celebrate, acknowledge all the achievements and contributions of the Health and Human Services Department over 150 years and many more years to come. The Evanston Health Department, if I am to describe it, is quite unique. I would describe it as a flag bearer, a forerunner when it comes to public health policies in this region. The Evanston Health Department, as one of the few oldest health departments in the region, Chicago is the oldest. We actually precede the Illinois Department of Public Health by 3 years, so that shows you the legacy of the Health and Human Services Department in Evanston. And as one of the oldest health departments, we strive to look in the lenses of public health. When we are doing so, the hallmarks of the department is using a mindset that is innovative, that is mission-driven in order to establish programs. And not only that, see it all the way through. Over the years, the department has embarked on public health strategies, initiatives, while navigating complex and complicated public health matters by establishing essential services and programs such as nursing, dentistry. I was still here when we had a dental office that was dissolved, I believe, in 2009. Food safety, water safety, vaccinations, child and maternal care, emergency preparedness, human services, ombudsman, workforce, communicable disease prevention, lead prevention, tobacco prevention policy, and so on. All of these to improve the overall health of the community. To some, public health is misunderstood or is confusing. In a nutshell, public health focuses on the overall health of the community, to establish activities, strategies, initiatives to achieve desirable health outcomes. Most people don't think about public health, to be honest, until a disaster strikes, until there's a pandemic, there's an outbreak, there is a hurricane. But I can assure you that we work every day to keep our community safe. Why do we do it? It is our calling. It is our mission to do what we do. It was our calling in 1874. It has been our calling throughout these years. It is our calling today, and it will be our calling in years to come. To 150 years now, to 150 years to come. Thank you for your support of the Health and Human Services Department. Thank you for all the collaboration. Thank you for all you do. We truly appreciate you. Thank you, and continue to have a pleasant day.
That's going to be the city's slogan. Continue to have a pleasant day. You can pay your parking ticket on the ground floor. Have a great day. All right, we will close in just a moment, but I would like to invite the Health and Human Services Department, Greg, Indira, and your team to come on up.
All right, hi everyone. I hope this event has found you in good spirits. So throughout this event tonight, we've seen a lot of the challenges that our health department had to tackle over the past 150 years. Presently, we have our fair share of challenges, but I think we can all agree that the biggest challenge we had was COVID-19. COVID turned the world absolutely upside down. In the beginning, it was chaos. We were all learning about it together. People were sanitizing their groceries before they brought them into their house. My sister was doing that. I had to tell her to stop. People were even afraid to leave the house. But during this chaotic time of just a lot of unknown and fear, we here in Evanston, we had our fearless leader, Ike Ugbo, who was personally visiting every single long-term care facility, making sure that they had everything that they needed to protect our most vulnerable residents. And, Ike doing that kind of really set the tone for the rest of our response. And I've told some of our staff that, I don't think anyone outside of public health or outside of the health department will really ever grasp how hard each one of us worked. I could go through examples of every single staff member and just the work that they've put in. But at the end of the day, we were all just following the example that Ike set. He has a very steady voice, obviously, a very calming demeanor when everything around us was chaotic. And I think I speak for everyone in HHS, every department in the city, and everyone in the city when I say, a giant heartfelt thank you. And so on behalf of everyone in HHS, we would like to award you a commemorative crystal, I guess. Or it's a priceless gem. So Ike, if you'd like to come on up, accept it, and maybe read out the little inscription.
They put my entire name on this. Ikenga Obo. Thank you. This is tremendous. When we started preparing for COVID-19, we didn't start preparing in 2020. We started preparing in 2019 when we heard about this weird virus elsewhere. At the time, there really wasn't any concern. And given that we are a very small health department, we assembled a very small group to maintain situational awareness and start brainstorming on what the next action would be if COVID ever reaches Evanston. That group comprised of me, our communicable disease specialist then, she's now our senior communicable disease specialist, Elizabeth Lassiter, Greg, and I believe Inaz as well, who is our emergency preparedness coordinator. The four of us were brainstorming on ways in which we ought to establish strategies to protect the community. At the initial stages of COVID, it was dark. Mayor Haggerty, you remember as well. There were times when long-term care facilities were relying on the city for PPE. There were times when our phones were blowing up. We need this, we need that. There was a time when we ran out of PPE that we started giving out garbage bags. That's how bad it was. So these stories are not really told because we didn't absorb what we were feeling at that time. We were reactive. We wanted to keep moving. And I want to thank my team who were very instrumental. They worked really hard, hours upon hours. There'll be some times I'll be calling our communicable disease specialists and others late at night regarding situations at hand. And all their efforts have not gone unnoticed. I truly, truly appreciate you. And also for listening and being there as well. And not only that, I do have a number of staff members who will check on me regarding my mental state to make sure that I'm doing okay. But like Greg mentioned, it was a novel virus. This is something that we've never experienced before. But it's remarkable how we rallied together from a department standpoint to figure it out. There were a number of strategies that we employed that other communities were trying to tailor. I think we were one of the first communities to establish contact tracing. We were one of the first communities to establish homebound vaccinations for those who are living with disabilities or elderly or bedridden who cannot make it to our vaccination sites. We provided housing for the unhoused who couldn't quarantine or isolate effectively in their respective homes. We did a lot during that period. It wouldn't have been accomplished just by the department. I want to acknowledge everyone who contributed, all the staff. I have worked in Evanston for a long time, and I saw firsthand how collaborative the city can be. All departments were involved, all hands on deck. And also we had a mayor who was aware of emergency preparedness, and he was there for us as well. We were also following in his lead, Mayor Haggerty. So this is not just for me, this is for the Health and Human Services Department. This is for all departments who worked on COVID. This is for Mayor Haggerty for providing guidance as well. When Mayor Haggerty told me that he was leaving, I said, "Are you sure?" And he said, "Yeah, he's leaving." Then Mayor Biss took over from there. So thank you all. I truly appreciate this. I wasn't expecting this at all. I really wasn't. So thank you. I truly appreciate this. And this is for all of us. Thank you.
Thank you. I think we should take a moment and thank Ike and his amazing team for this wonderful event, and just truly all of you do, and we appreciate it. I would be remiss if I didn't say how I use Greg and Ike as my personal health advisors throughout the year for anything that occurs at the police department, but and within 311 as well. But really, if we can give them a round of applause for this amazing event. And congratulations on 150 years. And no, I wasn't there in 1874. So that concludes our formal portion of this evening. I do have a few jokes left. Luke's still here? Oh, he's gone. I can do them. No, just kidding. So at this time, we'd like to open the floor. If anyone would like to come up and say a few words, we'd like to go home by 2. So just keep that in mind. But if anyone would like to come up. I think the bar is still open. So maybe a little liquid courage. So that does conclude our program. And as we wrap up this incredible celebration of dedication and excellence, I just want to remind everyone, laughter is the best medicine. Unless, of course, you're dealing with an actual medical emergency, in which case, please stick to the protocol as opposed to any of my jokes. So with that, we thank you for joining us, and let's keep working to make the world healthier, one laugh at a time. So thank you, everyone. Have a wonderful evening.